The following are procedures on how to properly reconstitute a drug powder for injection. Remove cap from the sterile water for injection vial. Wipe vial port with 70% IPA. Wipe once towards you, following the direction of the airflow. Unwrap multi-dose vial adapter. Make sure to avoid contact with the critical areas. Screw adapter to puncture and lock into the vial's injection port. Remove drug vial cap. Wipe all ports with 70% IPA. Be sure to use one alcohol swab for each port. Wipe around the adapter's lure lock threads and the top. Unwrap needle as if you are peeling a banana. Place needle with cap in the capping device without touching the critical areas. Unwrap syringe as if you're peeling a banana. Loosen the plunger from the barrel by pulling it back and forth, then put air in the syringe. Set the top flat tip of the plunger at the desired volume. Screw the syringe into the adapter's lure lock connected to the diluent vial. Cartwheel syringe to invert the vial. Draw fluid from the vial into the syringe barrel by using the milking technique. This is done by pulling the plunger back and forth until you have achieved the desired volume. Push the plunger up to push air or liquid back into the vial. Pull the plunger down to draw fluid into the syringe. Once you have the volume that you needed, cartwheel down the syringe. Unscrew the syringe from the adapter. Connect the syringe and the needle without shadowing or touching the critical areas. Uncap needle by pulling the cap away from the needle in horizontal position. Place cap in the capping device. With the drug vial grounded and the bevel facing up, insert the needle into the vial's injection port. Insert needle at an angle going from 45 to 90 degrees simultaneously. Inject the diluent into the drug vial by pushing the plunger down. Allow air pressure to escape from the vial and flow back into the syringe by releasing the plunger. Once all contents are injected into the vial, pull the needle and syringe out. Use your thumb to lock the needle safety cap. Shake drug vial until all contents have been dissolved. Be sure to wipe the drug vial's injection port each time you insert the needle. Unwrap needle as if you are peeling a banana. You may place it between your fingers instead of placing it in the capping device. Be sure not to shadow or touch the critical areas. Unwrap syringe as if you're peeling a banana. Tuck needle and syringe between fingers adjacent to each other without shadowing or touching the critical areas. Connect the syringe to the needle without shadowing or touching the critical areas. Uncap needle by pulling the cap away from the needle in horizontal position. Place cap in the capping device. Loosen the plunger from the barrel by pulling it back and forth, then put air in the syringe. Set the top flat tip of the plunger at the volume desired. Draw fluid from the vial into the syringe barrel by using the milking technique. The following are various acceptable hand positioning techniques on how to draw drug from the vial. You may pick whichever works for you. Remember, do not touch or shadow the critical areas. The following steps are for IM or IV push med orders. After drawing the drug volume desired, use your thumb to lock safety needle cap or use the capping device. Untwist to remove needle from the syringe. Cartwheel syringe and gently screw onto the syringe cap. Visually inspect final product for any leaks. Check for particulates against the light and against the dark. And finally, double check the final volume of your product. The following steps are for piggyback med orders. Remove IV bag port cap. Wipe IV bag port with 70% IPA. Reposition bag without shadowing as necessary. Uncap needle by pulling the cap away from the needle in the horizontal position. Place cap in the capping device. Inject drug into the IV bag through the correct port. Recap needle using capping device or use your thumb to lock cap when using safety needle. Visually inspect final product by checking for particulates against the light and against the dark, and gently squeeze IV bag with the ejection port facing down to check for leaks. And finally, place tamper evidence seal to the injection port. Place your initials on the label and properly attach label to your product. Be sure to lay out materials used for pharmacists to check. Remember, always double check your final product. Adjust as necessary so the tip of the filter straw touches the inside bottom of the ampule. Push the plunger up to push air out and excess fluid back into the ampule. Uncap needle by pulling the cap away from the needle in horizontal position. Place cap in the capping device. Place your initials on the label and properly attach the label to your product. Be sure to lay out materials used for the pharmacist to check. Remember to always double check your final product. Dun, ta-da!